Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Hi, now looking at the treatment for alcohol disorder or addiction disorder. We'll start with the biological approaches. The biological approaches to substance use disorder include detoxification, which is a process of ridding the body of alcohol and drugs. Now, this is supervised and monitored in an attempt to control symptoms. Also included in the biological approach to treatment is the use of disulfiram, methadone, naloxone, and antidepressants and nicotine replacement therapy are examples. So let's consider each of these. Disulfiram, or the brand name of Antabuse, an alcohol patch, if you will, produces an adverse reaction to drinking alcohol, not unlike a nicotine patch. Antidepressants are used with cocaine treatment. It acts as a regulator of feelings of pleasure, although this approach has not been consistent with its results. Methadone maintenance programs use a synthetic opiate used for heroin addiction. It does come with its own risks. Addiction seems kind of an odd way to go, doesn't it? Naloxone and naltrexone are sister drugs that block the effect of heroin and other opiates. Now, one form of treatment you may have heard are those referred to as non-professional support groups. A non-professional support group like Alcoholics Anonymous, AA, Narcotics Anonymous, NA, Cocaine Anonymous, CA, promote abstinence within a supportive group setting. This most widely used non-professional program, Alcoholics Anonymous, is based on the belief that alcoholism is a disease, not a sin, and uses a one-step program. The success rate is difficult to determine, as these groups do not keep records of the members or they do not conduct controlled studies for their programs. Now, there are residential approaches. A residential treatment approach includes hospitals and therapeutic communities. Outpatient treatment is less costly and often indicated when withdrawal symptoms are less severe. Clients are committed to changing their adaptive behavior, and the environmental support systems such as family strive to help clients make the transition to a drug-free lifestyle. The psychodynamic approaches. The psychodynamic therapist focuses on uncovering the inner conflicts originating in childhood that are believed to be at the root of substance abuse disorders. Now, that's a consistent flavor of psychodynamic approaches. And then, of course, there's the cognitive behavior approach, where behavior therapists focus on helping people with substance abuse-related disorders change problem behavior through such techniques as self-control training, self-skills training, cue exposure training, and motivational enhancement therapy, or MET approaches. Now, the self-control strategies, these strategies follow the ABCs. The antecedent, which is the trigger, the abusive behavior, then the consequences, or the reinforcement of the behavior, as a means of gaining control over the change of abusive behavior. If you're familiar with the trigger, you know what the abusive behavior is. That's your alcohol or drug use. And the consequence, how it reinforces. By knowing these two things enables, with support, to figure out how to disengage the trigger or to change the reinforcement schedule. Social skills training. This can include assertiveness training, couples therapy by identifying triggers and support through behavioral contracts. The cue exposure training. Now, these types are showing some promise. Here, a person is exposed to their abused substance, alcohol or drugs, and are prevented from using. In other words, it's an attempt to extinguish the person's learned response to alcohol and drugs. The motivational enhancement therapy, or the MET, this therapy is designed to create an intrinsic motivation to want to change. You cannot make someone change without their permission. Helping them gain an intrinsic reason to get better means that the therapist is always attempting to convince the patient to participate. They have their own reasons to want to engage. Then there's relapse prevention training. Now, regardless of the initial success of the treatment technique, relapse remains a pressing problem with any treatment that people with substance abuse disorder use. Relapse prevention training employs cognitive behavioral techniques to help people in recovery cope with high-risk situations and to prevent lapses from becoming relapses by helping participants to interpret lapses in less damaging ways. All right, we have completed a review of substance-related and addictive disorders. Now it is, as many of the other disorders, complex in our understanding of the causes and the interconnectedness of treatments. I hope you've gained something from this chapter, and we'll be reviewing Chapter 9, Gender Dysphoria, Paraphiliac Disorders, and Sexual Dysfunctions in Week 9. So I'll see you there, and good luck, everybody. Keep up the good work. Bye now.